Welcome back. Alzheimer's is a common type of dementia, a disorder that slowly ruins memory and thinking skills until it destroys the patient's ability to do simple tasks. Researchers say they've developed a blood test that can not only help diagnose Alzheimer's disease, but it can also tell doctors how far the disease has progressed. Dr. Reena Mehta joins us with a closer look at what this test could mean for patients. Very exciting.
Yeah, I mean, as we know, Alzheimer's is a pretty common disorder. 55 million people have this problem. And so if there are better ways we can not only diagnose it, but also stage the disease, that can be very helpful for families to better understand the future.
Because we were just talking during the commercial break, so easy. It seems like the patients can just get tossed into an Alzheimer's bucket with no real answer. And well, hold on, is it early? Is it somewhere in the middle? Are we too far gone? So talk to me about what they're looking at in this test.
Okay, so this was a study that was published in Nature Medicine from WashU in St. Louis, where they looked at proteins in the brain that can be affiliated with Alzheimer's, so specifically called MBTR243 tau.
Okay.
And so it's a blood test that they found where if they have higher levels of this protein, it's 92% accuracy linked with advanced Alzheimer's disease.
Okay, so based on how many of those proteins, they can kind of decide whether that's advanced or early on.
That's absolutely right. So they found that those with advanced Alzheimer's actually had 200 times higher levels of this MBTR tau 240 protein.
Yeah, so that's got to be really helpful for families when it comes to making decisions on care, treatment, and things of that nature.
Yeah, that's absolutely right. So, you know, when you try to diagnose these things like a PET scan or CSF through lumbar puncture, those are pretty invasive, you know, modalities. Thinking about a blood test it's an easy way to diagnose these things and better understand the progression of the disease. And hopefully with future therapeutics, if you know that those levels are high, could we direct a therapy to bring those tau proteins down? We call it precision medicine or biologic therapy. If we can actually target the part of the brain where those proteins are high and bring them down, then that could be really amazing.
It would be amazing. I know so many studies are happening right now for Alzheimer's. It's one of those types of diseases that is so heartbreaking, but we really don't know too much about it because we're still learning much about the brain as well. Is this blood test readily available, or is it something that you need to talk to your doctor about and see how to get that?
Right, so not yet. This was just kind of one study that came out. Hopefully with time, it will be something that is available. They're looking to do bigger studies. You know, this was a study with slightly over 100 patients. And so the hope is that if they can, you know, increase the study volume to show that there is this great correlation, with time it will be readily available.
It'll be very exciting for a lot of families where Alzheimer's kind of a generational thing there. For folks out there who are watching, what are some signs and symptoms of dementia and Alzheimer's based on what we already know, the menial tasks kind of losing focus, but what are some other things to look out for?
Exactly, like so forgetfulness, you know, trying to recall memory things that can happen, you know, sort of stuttering sometimes, and some of those like kind of subtle neurological deficiencies may be early signs of Alzheimer's. And so, you know, there's also different kinds of dementia, as we were talking before. There's lots of reasons to have like cognitive impairments. So I think what's interesting about this study is it really does not only tell you the progression, but it further says this is Alzheimer's versus other reasons of cognitive dementia.
Because it's testing your blood, so maybe it finds, oh, well, there's something else going on here. It's not Alzheimer's.
It's not Alzheimer's. It's another form of dementia.
Let's treat that.
Exactly.
Good. All right, Dr. Mehta, thanks for being here. Good information.
Thank you so much for having me.